Good day, I'm Hanajin A. Dayaw, your student nurse from BSN 3E, Nevesia University of Science Technology. Today, I'm going to demonstrate the NGT feeding. Assessment. Doctor's order. Rationale, because these procedures depends on the doctor's order. Client's level of consciousness and level of knowledge and understanding. Rationale, it is important for our patients that we assess accurately to a recognized change in their clinical status, as this allows us to act in a timely and effective manner to manage their care. Availability and functionality of the needed materials. Rationale, the availability of sufficient modern equipment in the workplace plays a key role in facilitating care delivery, a decrease in stress, no delay to care, and patient satisfaction. Assess for any clinical signs of malnutrition or dehydration. Rationale, because nutrition and hydration are essential for health and quality of life. For example, older people. Adequate food and drink can help them recover from illness and surgery, remain independent, reduce their length of stay in hospital, and help avoid admission to hospital. For allergies to any food in the feeding, if the client is lactose intolerant, check the tube feeding formula. Notify the primary care provider if any incompatibilities exist. Rationale, because you cannot predict how severe someone reacts. It is important to treat all food allergies the same. Planning. Before commencing a tube feeding, determine the type, amount, and frequency of feedings and tolerance of previous feedings. Prepare equipment. Correct type and amount of feeding solution. 60 ml catheter tip syringe, emesis basin, clean gloves, pH test strip or meter, large syringe or calibrated plastic feeding bag with label and tubing that can be attached to the feeding tube, or refilled bottle with a drip chamber, tubing, and a flow regulator clamp. Measuring container from which to pour the feeding. Water at room temperature. Feeding pump as required. Implementation. Procedure. Prior to performing the feeding, introduce self and verify the client's identity using agency protocol. Explain to the client what you're going to do, when it is necessary, and how he or she can participate. Inform the client that the feeding should not cause any discomfort, but may cause a feeling of fullness. Rationale. A friendly introduction explaining your role and what you intend to do is their first rank in the ladder to building rapport with the patient, establishing the essential trust and therapeutic relationship. Perform hand hygiene and observe appropriate infection control procedures. Rationale, this prevents the transmission of microorganisms. Provide privacy for this procedure if the client desires. Tube feedings are embarrassing to some people. Rationale, privacy involves protecting patients' integrity. Assess tube placement. Apply clean gloves. Attach the syringe to the open end of the tube and aspirate. Check the pH. Rationale, aspirating a small amount of gastric contents to check the color, consistency, and pH to help confirm tube placement. Allow 1 hour to elapse before testing the pH if the client has received a medication. Rationale, because gastric pH levels may be elevated above 5 as a result of medication, reflux of intestinal contents into the stomach, or owing to continuous feeding. Use a pH meter rather than pH paper if the client is receiving continuous feeding. Follow agency policy if the patient is equal to or greater than 6. Rationale, testing the pH of gastric aspirate to show pH less than or equal to 5.5 is recommended first-line test to confirm correct placement of nasogastric tubes and reduce the risk of potentially fatal aspiration. Assess residual feeding contents. If the tube is placed in the stomach, aspirate all contents and measure the amount before administering the feeding. Administer the feeding. Before administering feeding, check the expiration date of the feeding. Warm the feeding to room temperature. Rationale, an excessively cold feeding may cause abdominal cramps. Clamp the feeding tube. Clamp the feeding tube before all of the water is instilled. Rationale, clamping prevents air from entering the tube. Ensure client comfort and safety. Secure the tubing to the client's gown. Rationale, this minimizes pulling off the tube, thus preventing discomfort and dislodgement. Ask the client to remain sitting upright in Fowler's position or in a slightly elevated right lateral position for at least 30 minutes. Rationale, these positions facilitate digestion and movement of the feeding from the stomach along the alimentary tract and prevent the potential aspirations of the feeding in the lungs. Good day, I am Hannah Jane A. Dayao and I will be your nurse for today. Is that fine with you? Can I check your name tag, please? For clarification, can I ask what is your name?
Hermione Cavent,
Birth date?
August 22, 2001.
Okay, Ma'am Caventa, today I will be proceeding to feed you through the NGT that is placed inside you, and you can participate while I'm doing the procedure. All you have to do is to tell me if you feel any discomfort that you're feeling, and if you have no discomfort, then you will feel a feeling of fullness. May I start now, Ma'am Caventa? done. Thank you. For evaluation, evaluate the patient's response to the procedure. Document the procedure and other important data on the client's chart. And that's how you do the NGT feeding. Thank you for watching. Bye!